My name is Dr. Eric Obeng Edmonds. This study pertains to addressing healthcare interventions in rural communities, making a case for complementary evidence-based decision making for preventive healthcare in Ghana. If the goal of any research and impactful fact finding is to solve a problem, it is imperative to first identify actual problems from reliable sources on the ground and prescribe appropriate solutions. In rural hospitals like Ghana, the lack of reliable and objective data results in ad hoc and misaligned interventions. Understandably, organizations rely heavily on prescriber judgment, like doctors and physician assistants, to design solutions for underserved rural communities. While prescriber judgment is invaluable, without objective empirical data on the back end to validate the recommendations, the over reliance on experience and judgment alone can lead to one, misalignment, where the solutions designed do not align well with the actual needs of patients or communities, or two, dangerous healthcare consequences, where inaccurate and improperly tailored solutions lead to misdiagnosis, ineffective treatments, or even harm to patients. A 2016 World Economic Forum report made the same argument, specifically pointing out that this problem leads to misallocation of resources and suboptimal health outcomes. The purpose of the study is to understand how prescribers with clinical expertise in rural hospitals make accurate diagnosis and make recommendations for healthcare interventions. Using Bronfenbrenner's ecological systems theory as a guiding lens, the fundamental question remains: in what ways does the direct, modulating, and indirect influences of the environment in turn influence healthcare decision making and recommendations? The ideal methodology of inquiry was a qualitative approach that seeks to understand the phenomenon. As such, the study used semi-structured interviews to gather data from 12 prescribers, medical doctors, and physician assistants. One important process was triangulation, leaning on additional empirical data and records from an electronic medical record system of the same period. According to Bronfenbrenner, a range of external factors with varying degrees of proximity influence human development and subsequent socialization process, and by extension, their decision-making process. The circles enveloping a prescriber in this case represent this idea of embedded structures, each as a layer of environmental influence. Thus, Bronfenbrenner concluded that an individual adapts to environmental conditions, forming their social construction of reality and epistemology. For the local medical doctors and physician assistants on whose knowledge organizations and providers depend on, relying on judgment alone to make life-changing healthcare recommendations opened the door for certain risks, including cognitive biases, misattribution, and misdiagnosis. The problem is clear. The lack of reliable and objective data results in ad hoc and misaligned interventions, and the research findings pointed us to a single premise: better evidence promotes informed decision making. In rural under-resourced communities, the environmental complexity requires objective information. Empirical data is critical, but it is prudent to integrate prescriber experiences and epistemologies as contextual factors. This is the essence of complementary, contextually accurate information needed to design effective healthcare interventions. The source of information to design any intervention is key. Data should always complement judgment and not replace it. There were several important lessons from this study, but the key takeaway is this: without the knowledge of where to implement which solution, people will die needlessly in rural communities. The sad fact will be that life-saving solutions would have been within reach the whole time. Wouldn't that be a shame?